My name's Shannon Harwood, and I'm absolutely delighted to be able to come along and share my story of adopting a ketogenic therapy in my life as a person with bipolar 2 disorder. So I had a fairly standard presentation of bipolar 2 in my life. Symptoms began for me at about the age of 15, 17. By 18, I had my first full bipolar episode, and those continued probably once every 18 months or 2 years for the next 25 years. But I didn't know that it was bipolar 2. I wasn't actually diagnosed until I was 40. And you think to yourself, well, bipolar 2 is counted as severe mental illness. How can that be, Shannon? How can you possibly have missed the fact that you were severely mentally ill? Well, bipolar disorder 2 is often misdiagnosed. One of the things that gets misdiagnosed for is major depressive disorder. So I did have that happen at one stage. So my life would be going along reasonably well, and then I'd get this influx of energy, and you think to yourself that drive is a good thing. Drive is a good thing. But being driven is not. And being driven by an energy that feels outside yourself. Yes, I was social. Yes, I was outgoing. I had all this energy. I didn't need sleep. I didn't need food. I didn't need anything. It was glorious. It got to the point of hypermania is less than mania. So I still had contact with reality. However, I'd lost judgment or reason, which means that it wasn't picked up. Perhaps if I'd been fully manic, it would have been picked up, but it wasn't picked up. And especially during those highs, I really would do damage to things like relationships, jobs, housing. In my 20s, after I stopped looking for a reason for these depressions, because I realized that I wasn't depressed about things that were happening in my life. I was just depressed for no reason, and I thought, well, that's my lot in life. That's just the kind of person I am, and I'll probably learn something from that on my life's journey. But there's nothing that can be done about that. In my 30s, when I came to terms with the fact that those depressions would just appear, it sort of became easier in a way, because I knew I'd done it so many times that I knew that those depressions cleared again. So for someone who hasn't experienced bipolar, that all probably sounds a little strange, but I guess I'd just like to say that, bipolar disorder is such a disorder. It's called a mood disorder. So you think that you're feeling good or you're feeling sad. But as much as bipolar is classified as a mood disorder, when you're living it, a bipolar depression is a depression that is as much about energy. I guess my advocacy message in this space is that healing is possible. So I just want to say, if you're sitting out there at this very moment in time and you can totally relate to what I just said, the reason that I am here is because I don't have those moments in time anymore. Skip forward, I'm now 40. I have a very bad episode. I realize I have bipolar. So I go to my doctors and say, I've got bipolar. They confirm it, psychiatrists confirm it. I look back over my life. I then start a journey that is a journey of medications from the medical model that I engage with. And on the other hand, it's a journey of lifestyle interventions. And I take those two journeys alongside each other, medical model medications, lifestyle interventions. And I do that between the ages of 40 and 48. And I find that I'm actually able to improve bipolar in my life using those things. At 48, I learned that ketogenic therapy is used in epileptic. The ketogenic therapy is used for people who have epilepsy to control seizures, which was interesting to me because you are somebody out there with bipolar 2 disorder who takes medication, it is likely that some of the medications that you take, the benzodiazepines, sodium valproate, lamictal, these are medications that are used in epilepsy. When I heard that in epilepsy, if medications don't work, they use a ketogenic diet, I just thought, I'm on these medications and they're not working, so I'm going to read about this ketogenic diet. And I didn't really believe it particularly. And I came across the work of Ian Campbell, who said it was like the lights went back on in his brain. And I thought, well, that's probably not right, really, is it? I mean, by now you've got to remember, by now it's 35 years of unremitting bipolar episodes from the age of 15 to 48. I found out a lot about the ketogenic diet. I did a lot of reading and a lot of research, and then I began it. And 5 days later, it was like the lights went back on in my brain. After 35 years, I felt a clear energy and an ability to connect with my own thinking with a level of clarity, but not driven energy. This is a calm, clear energy in a way that I hadn't felt since I was 15 years old. So 25 years untreated, very, very difficult and problematic in my life. 10 years treated through standard therapies. Some of those were incredibly difficult. Some made the underlying illness worse. Some strategies were helpful. I try not to use the word miracle. I really try hard not to use the word miracle. But what can you say if you've lived with something for 35 years that I wasn't able to work full time, I wasn't able to get qualifications, my parenting were troubled, my relationships were troubled, it was parts of my life were just a train wreck. What do you say when at 48, 49 years of age, that all just disappears and you get to start living the life that you thought that you might have as a person at 15 or 17. But it wasn't a miracle that happened to Shannon Harwood. It was ketogenic therapy that happened to me. It's not a miracle at all. It's something that can be replicated by other people. And now I spend my time in the advocacy message that healing is possible. And if you have a diagnosis of severe mental illness, that may be something that you have not heard a lot as you pursue treatment through the medical model. If someone came to me and I had serious mental illness, or even if they just had, brain fog or low moods or anxiety in their life. But if they did come to me and they had serious mental illness, so we're talking bipolar, schizoaffective disorder, schizophrenia, those types of illness, would I recommend trying a ketogenic therapy and a ketogenic diet, and why would I do it? I would say this. When you look at something like ketogenic therapy, and I looked at it, and when I thought about trying it, I thought, well, what are the risks and what are the benefits? And it turns out that ketogenic therapy has been used in epilepsy for 100 years. So the risks have been really closely looked at. So, I mean, there are no large-scale risks associated with ketogenic therapy. And what are the possible benefits? So I'm sitting here telling a story about complete remission. I no longer have any symptoms to manage whatsoever in bipolar disorder, which had been, I've worked with 4 or 5 psychiatrists, many doctors. No doubt I had bipolar 2 disorder. In fact, one of the other benefits of me doing ketogenic therapy is I no longer take any medications. So I did add them up the other day, and I had 14, but then I realised I'd missed 3. So there were 17 different medications. It took me 3 years to taper carefully and slowly. But 3 years on from starting ketogenic therapy, I no longer take medication, I no longer have any symptoms, and I no longer face any of the risks of those medications. So, for example, I used to take lithium. Well, lithium and renal problems, kidney problems, and lithium toxicity, we're not talking about small risks that come with medications. We're talking about considerable risks. So weigh up the risks and benefits, have a look at a ketogenic therapy with those risks and benefits in mind, and then have a think about whether you might like to look for root cause healing rather than symptom management.